I'm Dr. Guy Yatros, and I think my good friend and partner, Dr. Richard Drake, I think is joining us here as we speak. So we'll get started in about 4 minutes.
Can you hear me?
Hey, Rich, we're live, just to let you know. I think you just showed up.
Test. Can you hear me?
I can hear you a little bit low. Maybe it's my mic.
Testing, 1, 2, 3.
Yeah, nice and clear, just not as loud as maybe it could be.
Is that any better? Test. Is that any better?
Yeah, that's better.
Testing, 1, 2, 3. Testing.
That's a little better. That sounds pretty good.
Testing, 1, 2, 3.
Yeah, it's much better, sir.
Okay.
Again, we're live on here, everyone. Thank you for showing up. We're going to start in 3 minutes. Looks like we're about to get our audio visual worked out.
Always something, man. Your computer wants to restart when you get ready to set up or something, isn't it?
Yeah, I hate that it's going to update right before the webinar. So that's happened to me before as well. But no, we're good to go. You're sounding good, man.
Well, you're looking pretty good for just having gone through Irma, and then in Texas we just went through Harvey. I wonder if we should have a complex guy. These hurricanes following us around or something.
I think we might want to move to Alaska or something, but then they probably have their own meteorological challenges there as well. So we're all healthy here, and that's what matters. And happy that I could find an internet connection and power at my mother's house. I don't have it at my house or our office right now. So it's just fortunate that we didn't have any more damage than we did, and that we're all safe.
That's for sure.
We'll get started here in just a couple of minutes. Everyone is, we have you muted because we have over 300 people signed up tonight. And so it gets a little out of control when everyone's talking. But if you want to type in any questions that you have in the questions box, we'll be answering those as we go. And we'll stick around as long as necessary to answer those for you. So just type them in there in the questions box, and we'll be happy to get to them.
And I'm sitting in my living room, Guy, where the clock is dinging. So when you hear one ding, it's halfway through, and when you hear 8 dings, it's time to quit.
We'll stay. I think we'll keep this one right on time in an hour. But again, we'll be happy to stay on as long as necessary to answer questions. But we'll be finished within the hour. And I think it's a good subject. We do a lot of these webinars. We're going to reference some of the past webinars we've completed, but today we're going to focus on the do's and don'ts of the dental sleep consultation appointments. And this is maybe the most important one we do because if we don't get our patients to say yes to sleep testing as well as to dental sleep treatment, then all the other things we do, treatment steps, devices, which ones to select, insurance, all this really doesn't matter if we can't communicate well with our patient. So that's what we're going to talk about tonight. And Rich, it's 8 o'clock here in Florida, on the west coast of Florida, and 7 o'clock there for you. So what do you say we get started?
I'm ready. Let's get going.
Well, first of all, we do want to say a word about Irma. Our corporate office here is in Florida. And I know we're all safe. Everyone in our corporate office is safe. We did get some damage at certain areas, but we're safe. And I know further south, some of our members, some of the people that listen to our webinars weren't as fortunate. The people in Texas weren't as fortunate. So we wish them the best. And I'm glad that I can find them at my mother's condo because we don't have power at my house nor at our office. But I'm at my mom's, and that's my mom there in front of her favorite restaurant / kind of little local bar, which is about a half mile from where I'm sitting. and my mom's name is Irma. So this is all her fault. So I took that picture on our way out of town to where we weathered the storm out in a hotel. And so I thought that I'd share the picture of my mom, Irma, there in front of Hurricane Hanks. We'll plug Hurricane Hanks if you're ever on Anna Maria Island. And all in all, it could have been much worse for us. There's certainly some damage, but I'm just happy to be here. And Rich, I'm happy you're there and you're safe from the storms in Houston. And hopefully we can get on back to our regular lives now. So with that being said, let's talk about the do's and don'ts of the dental sleep medicine consultation. I think first we want to talk about why we treat sleep apnea. Rich, and I like the way you put the slide. Rich did this slide, and we talk about why we. And I think we as dentists and dental sleep dentists, what do we kind of focus on some things that because we're medical professionals. So, Rich, you may decide what you want to say about how we as dentists and dental sleep professionals think.
Yeah, and I would even add in there physicians as well, Guy. I mean, I think this is why we get into the healthcare profession, because we're, for the most part, we got good hearts and we want to help people and do that kind of stuff. And when we hear something like, the odds ratio for a heart attack is 3 times higher, for blood pressure is 4 times higher, for stroke is 7, for an automobile accident it's 10, the daytime sleepiness. So I think we tend to think that everybody thinks like we do. And, some guy comes in and is, well, yeah, but I'm, so you're going to have a heart attack. Everybody's got to die of something, I mean, I tell you, I like to have a quarter for every time I heard that. I've had a lot of quarters. So, we want to compare and contrast why we do it and why patients do it and, what keeps them from doing it. But there are some really good reasons here. If somebody wants to be healthier, and most people do, they wouldn't be in your office and they wouldn't be talking to you about this if health was not a concern. But it's not always the only thing. So I think it's important, Guy, that we distinguish why we do it and maybe why patients do it.
Yeah, and I think what we want to point out here is that everything on the screen, if you don't treat the sleep apnea, it has a direct negative effect. So we can lead to each of the things like hypertension, heart attacks. And so I'll quote Pete Dawson here, one of my mentors, dentists that I learned a lot from over the years. And he said, every reasonable person wants a healthy mouth, if you just keep that in mind. And I think every reasonable person would prefer to be healthy, and they wouldn't prefer to have diabetes or cancer or GERD and all the things that we see on the screen. So we tend to concentrate on that. It is important. One of the reasons we treat sleep apnea is to be healthier and to live longer. But I think the next slide, Rich, I love the way you did this too. But patients, sometimes they care about health. Sometimes that's their motivating factor. And tonight we'll talk about verbal skills and how you key in on those things and what is important to the patients. But more times than not, the things on the screen here are what the patients care about. They may care about their health, but most of the time they're in there because maybe their spouse is dragging them by the ear and they're saying, you've got to get his snoring under control, or I'm gonna have to buy a bigger house or something, or maybe they're sleepy or low energy, or their quality of life is affected. So those symptoms, I will tell you, if we can find out what those are, identify them, and really get the patients to agree on why it is they're treating their apnea, and we agree on what the goals are of us treating it. What is the expected outcome? Just having that conversation will help have a good consultation. They'll see that you care about them. They'll see that you know what you're doing and that you're addressing their goals. But it's also going to help further down the road when you actually treat the patient, because their expectations will be in alignment with what we hopefully can deliver. So anything that we forgot on this list? Well,
you said a lot of good things there, Guy. I mean, you hit the nail on the head. Number one, we want to engage the patient. I on the back of my tailgate on my truck, Guy, I have a sign says Dr. Drake Sleep Solutions, and alternative to CPAP and treat your snoring, that kind of thing. And I'm pulling up to a stoplight the other day, and I just happened to look in my rear view mirror. And the guy's driving, and his girlfriend, his wife, whoever's next to him, she points like that, and she smacks him, like bam. And then she takes her phone, and you can tell she's taking a picture of the tailgate of my truck, So maybe I'll see that guy next week. But you're right. I mean, yeah, it's exactly. So I think the key there too, Guy, is engage the patient. You know, why are you here? You know, what is your chief complaint? If I could fix one thing, you know, we told you guys we would give you some verbiage to use in the consultation, and that's something that I use a lot is, you know, how can I help you? If I had my magic wand here and I waved it and I could fix one thing, what would it be? Oh, definitely the snoring. You know, I'm not sleepy, I'm not tired. I know I had a sleep study and I have sleep apnea, but it's mild. I'm doing this for my wife.
Right.
Well, then you got to address the snoring. You know, this guy's not sleepy and he's tired. So you have to get that out early.
Absolutely.
Very
and
good.
why the patients don't treat sleep apnea, and by the way, Rich, if you haven't had a chance to review, I changed the last one because I think that was a little bit different. We can add that, but I really think these are the three reasons. And we always assume it's cost. You know, I think that's a big problem of dentists is that we assume that, well, they're not doing this because of the cost, and that certainly is a reason. But you cannot go in with blinders on thinking, well, the only reason they wouldn't say yes to this wonderful treatment is cost. Sometimes they don't think it'll work, and you know who they get that from as much as anybody is you, the dentist, because we fear it won't work, and we know that these don't work as well as we want sometimes, but most of the time they do. And really, how you approach that subject may be the most important verbal skill to learn, and we're going to walk you through that. But the fear that, well, I don't want to spend money, yeah, but it's not the money, it's that maybe that they're afraid it won't work or that they can't tolerate this device is it. You know, Rich had on here side effects. I think that's true sometimes, but that's not. I think these are the three.
Well, that's kind of lumped into the fear they can't wear it kind of thing.
Can't wear it, absolutely.
Yeah, because of that.
Right, and so I think understanding what their fears are, and this is true for any dental consultation, you know, I mean, what we're talking about here is understanding what the patient's goals are and what's their obstacles, and talking about that, and trying to get to the bottom of what they want and what's keeping them from getting what they want, and then giving them realistic expectations. So try to identify, you know, sometimes it's all three of these, sometimes it's one that's more important than the other, and if you can work through that with your patients, you're going to be a lot better off. So we promised you some don'ts and do's, and we'll start with the don'ts, and we're going to revisit these in case anybody has any questions. And by the way, a lot of people on tonight, if you have questions, I see some coming in the questions box, just keep typing them in the questions box. We'll get to them throughout the night, and by the time we're finished, we'll get to all your questions. So keep that going. But I think we could make this list as long as you want, but we tried to put 7, and I have an 8th one at the end that are real important. Rich, the first one is big. I'm bad on that one. I've learned a lot, right, when I first met you.
Oh yeah, you know, guys, and I love the way you make this simple now, Guy. But you know, what is your AHI? What was your LSAT? How much time did you have below 90? And the patient goes,
yeah.
What? What are you talking about? You know, I do my little imitation of, you know, and if the spouse is there, they always go, yeah, that's exactly what he looks like. You know, he's kind of choking and that kind of stuff. So, you know, what is an RDI? You know, the respiratory disturbance index, that's how many times your husband does that per hour. So we don't have to use big words. It's just you stop breathing, you know, you're not getting as much air as you should. And I think one thing as dentists that we really need to learn, Guy, is to learn to be comfortable with just a little bit of silence. You know, you put that one in there. Don't talk too much. I love that because we tend to get nervous when we talk. Talking too much shows actually your lack of confidence, and it shows in the patient's eyes, it shows incompetence. So we have to learn to be quiet sometimes, and you know, don't dodge the cost. I think you said it earlier, Guy, about, you know, if we're ashamed of how much we charge for a crown and we kind of dodge it, patients pick up on that stuff. So there are a lot of parallels and similarities with selling a dental case as well. I mean, you used to do that a lot, Guy. What would you say are the similarities?
Yeah, I mean, I think when it comes to cost, I think you have to be, a lot of this comes down to being confident and competent, like Rich said. And if you can't look somebody in the eye and tell them how much something is, then maybe you don't value what you're doing enough, or you're charging too much. And I learned that a long time ago. And I can look at a patient and I go, look, we're going to work with you on your insurance. we're going to do everything we can to make this affordable. But and at the bottom line, it may be X amount. But look, this is going to, you know, this could be life-saving for you. And, you know, it's up to them whether they value that or not. But you shouldn't, if you can't be comfortable about discussing the cost, then maybe you can get your team member to do it. We're going to talk about a team member that's real important in a minute. But I think you've got to ethically, you just got to embrace that this is an important thing for patients, and you've got to be comfortable that this is, you know, there's a cost that goes along with it. Other things on, anything else on the cost, Rich?
No, I want to talk about the guarantee, though, because
Yes.
what I say to people, Guy, when they say, well, you're going to guarantee this, you want how much for that piece of plastic? Well, you know, I mean, help save your life. You know, if it costs $1,000, and which I'm not saying it should, but you know, and it lasts 3 years, that's $1 a day. Well,
Right.
if you double that, it's $2 a day. If you triple it, it's only $3 a day. So I like to say, I'll tell you what, I will guarantee you that I will do everything in my power to make it fit, to make it comfortable, and to do every trick I know to manage, you know, whatever side effects come up. If you guarantee me that you're going to, you know, make every effort you can to wear it, I probably should change that if you'll guarantee me that your insurance company will pay me. That would probably be a fair trade-off now that I think about it. But I kind of like that verbiage, you know, because people will ask that. They'll say, well, would you guarantee this?
Right, and I think this is where you have to, you know what, I'm going to pull it the last one right now, because the last one is, don't be a dentist. And I think that, and we intentionally made this to, you know, kind of be funny, but it's true. As dentists, we're used to guaranteeing our work. This medical doctors never guarantee their work. I mean, you go in for anything, any kind of routine minor surgery, they're not going to guarantee it because they can't. And if they only got paid for successes, they'd all be, you know, very financially strapped. So you shouldn't have to apologize for this. These devices work the vast majority of the time. They do wonderful things for patients. You've got to embrace that and realize, hey, we're going to do everything we can, just like Rich said. And you can't have the dental mentality that if it doesn't do exactly this, then I'm a failure. And I think that's
hard for dentists, guys.
It is,
because we're taught that the crown has to be perfect.
right. And there's levels of success.
Yeah.
There's degrees of success. You may help their snoring and help their health, but we don't cure them. You know, it's not you can't just check it off that everything's perfect, but the patient's better off, you know, and sometimes patients can't tolerate the devices. Well, that's, you know, we do everything we can. So I think that's probably one of the biggest hurdles. And I think part of it is we're overthinking it. Dentists are, you know, really good at making things more complicated. And all this comes down to acting secure. You got to be secure about this. You got to be comfortable with the variable success. You got to be comfortable with the costs. You've got to be comfortable with what you're doing for the patient. And by cutting corners, what we're talking about is everything from education. You've got to educate your team, yourself, to where you understand this, believe in this, and know you can provide a quality service. And when you get to that point, then all these other things become easier, because then you are more confident. So we're not going to use cheap dental labs and the least expensive thing we can do, and it comes down to also our training. So those are the big don'ts. We concentrated on them a bit. I think I'll move on to the do's so that we can get to the more positive things. And I think, you know, all these are the opposites. Rich, you said this real well. I mean, we want to find out what their chief complaint is, what they're concerned about. Well, you can fix that one thing. What is that? And let's discuss it, and let's make sure that we agree on what we're trying to accomplish here. And I think we have it number one, because it probably is the most important. It's not only important to getting the patients to accept treatment, but it's also important in making your treatment successful. And the fears and anxiety, I think, come down to what we talked about before, as far as being confident in what we do and knowledgeable, and then we can talk to them. I don't run from when we do an informed consent, I don't hand it to them and run out of the room. I'm happy to discuss this. This is a decision. I'm not apologizing for anything anymore. If we were doing Crown and Bridge, a lot of scary things on those informed consents too, but we just have to be happy and comfortable with what we're doing. Rich, part of what we do here to the correct device, I think we put this on here, but that's part of what we need to do. but we could talk about that for a whole time, an hour, because we did. So if you want to know about choosing the correct device, you can go to our YouTube page, and we have a whole hour webinar on the correct device. Or you want to talk to one of our consultants, they'll be happy to talk to you about that as well. You do really the treatment plan a lot different than you would for dentistry, right, Rich?
You know, Guy, I've been doing this almost 20 years now, and I honestly don't even know if I could do a filling anymore. You know, yeah. Because my mind has actually kind of changed more to the medical side of things. You know, and people ask me if I guarantee it, I laugh. I go, are you kidding me? You know, I mean, you go in and get your gallbladder done, people die from doing that. You know, I mean, there aren't any guarantees, but I do like the verbiage that I used with that. I like the correct dental device. You know, we teach you can't make the wrong one, but you can make a better one. And like Guy said, go to our YouTube channel. You can listen to us blab for a whole hour about which one is best for you. We've said that a couple of times, Guy, already, about setting realistic expectations. You know, I sometimes I wonder, other than the grace of God, why my practice is so successful. You know, we're just so successful, and sometimes I think it's just, I just don't sugarcoat stuff. You know, are you going to guarantee this? No, I'm not going to guarantee it. You know, well, what if it breaks? Well, the manufacturer guarantees it for a year. You know, so we take digital models. We can do that. We can do all that stuff. But you got to know stuff. I mean, you said don't cut corners, Guy. I love that, because you got to. I can't reach across there and be there with you when you do a consultation. When somebody says, "Is this going to cure my snoring?" What do you say? Well, you know, the studies show that it's a 96% success rate. Five different studies show that. Now, the problem comes in, your wife's definition of success might be different than my wife's definition of success. So you got to talk about that. You got to know what those things are. But that's part of the realistic expectations. And when we talk about investing in your team, you got to remember there's 100 questions asked in your dental office every day, and only about 7 or 8 of them are asked to the dentist. Right. So if you're not taking your team with you, at least, you know, every other time, especially to dental sleep medicine, because it's so new. And I love the be prepared part, Guy, too, because we know we're going to talk tonight about, you know, what questions the patients are going to ask and all that other kind of stuff. So, and you did hit the nail on the head earlier, Guy, when you said, you know, be a real person, listen to them, have empathy, you know, that kind of stuff. I thought that was good. What do you mean by be organized?
Yeah, well, that's probably the biggest challenge in dental sleep. Putting all this together, their sleep study information, their symptoms, their goals, their financial, and having all that organized to where you can go in very quickly. So this seems like a lot we're talking about. Wow, it's going to be a 2-hour consultation. Not true. We're organized. I spend less than 10 minutes in a consultation. My team spends usually less than 20. So 30 minutes total, and oftentimes it's even less than that, because we're organized. We've talked a little bit about, hey, these things don't work sometimes, but they work most of the time. So I want to kind of end with, we are confident. Look, we help thousands and thousands of patients sleep better, sleep longer, live longer, snore less. We have testimonials, you know, stacks of them, and this is a wonderful treatment, but that we can do for patients. And so that confidence does come with experience. It comes with your education and a lot of things like that. But until you get there, I'll quote my mentor and friend Rich Drake: "Fake it till you make it." You've gotta walk in there with that kind of confidence, because these do work. They're a great thing. So these are some do's and don'ts. We got to move on. We'll come back to those and flash them up on the screen at the end. We won't spend a lot of time talking about us. You know who we are, a lot of you. Rich and I have been doing this for over 20 years. Over 30 years between us, probably over 35, with about 17, 18 years apiece. We've done thousands of devices. This is all we do, is help dentists succeed in dental sleep. We consider ourselves as the leaders in dental sleep education and implementation. It comes down to our mission statement, where we're the most trusted, innovative, customer-focused provider of solutions in dental sleep. And we provide coaching, training, software for the 4 pillars that I'll show you in a moment. And again, I'm going to go through this fairly quick. We'll have an opportunity at the end. If you really like this, you want us to do an in-person course, we're always adding these. We have a lot of 1-day, some 2-day courses. If you just type in course, and you'll get $100 off a 1-day and $200 off a 2-day course. Here's some of the dates. Just type that in, and it'll get you. One of our team members will register you as into that discount, and you can let us know which one of the courses you want to go to. We have our symposium coming up, and I'm just going to go through these, Rich, so that we can get back on schedule. This is awesome. The symposium we did last year, we had some of the leaders of the whole dental sleep industry all together in one spot, 1 hour of quick, informative topics that were just wonderful last year. We had such great feedback. We're doing this again in Clearwater Beach in February, which there will not be any hurricanes, I promise you.
Not in February, huh?
No, money back guarantee, no hurricanes, I promise you. So, and there's some great speakers there. If you're going to do that, you need to get your room soon, because we got a great discount on the rooms. And again, this is what we do. We call it the 4 pillars of dental sleep: screening, testing, treating, and billing. And we help provide everything you need to succeed at that, which is education, coaching, software, and support. If we don't answer some questions tonight and you have some dental sleep challenges, just type in consultation, consult, something like that into the questions. And one of our dental sleep medicine experts will call you, set up a time to just address it. If there's something you need clarification on, also they can talk to you about how we can help your practice puts dental sleep in there. So just type that in anytime, and you'll be happy you did. We have a room full of people that's all they do is train other dentists and dental offices and team members on how to do dental sleep. And then another one of these is coming up in a couple weeks.
Man, that Jason Tierney is keeping us busy, isn't he, guys? Every couple of weeks, he's got us working, man.
And this is another subject we haven't done,
Jason.
Yeah, and so it'll be wonderful. I haven't done the PowerPoint for it yet, but I promise you it'll be a great. This is how Rich and I did build the vast majority of our practices years ago. It's a wonderful way if you really want to get into dental sleep, and we'll talk about how you work with the medical community to really jumpstart and continue to grow your dental sleep practice. So we're going to go through a lot on, we really hit the high points first, I hope. We've decided to jump out blazing here with the real good information. And we're going to go through a lot more here before the night's over. And what we want to emphasize is this doesn't have, and I actually say it shouldn't be the dentist doing most of this. Most of what we're going over tonight, most of the things we're going to talk about doing, if you get a key team member that is their job is to do this, and we call them the sleep ambassador, most of this can be going on in the background. They can just explode your practice with dental sleep if you find that right person. And Rich, do you have anybody in your practice that fits these traits and what they do?
Yeah, about 5 of them. I found one wasn't enough, Guy. I had to have more than one. So again, where people are asking questions, and you gotta, you don't have to have somebody who is a dental assistant to do this. You don't, you could have a really good waitress at the restaurant that you're at and train her how to do this, right? If she's empathetic and, look at the traits: organized, they just want to learn, they'll take initiative; multitasker, that sounds like a really good employee. Guy, I'd like 10 of those if I could place my order, please. But you're right. We need people like that. And, how many times, Guy, have we said, if you'll just hire that sleep ambassador, it will bring you 4 to 10-fold back what that person costs you. And not very many dentists take us up on it. But we can tell you the ones that do, that's what happens, can't we?
100% of the ones that have done that have just, their practices have reached beyond the level. Yeah, so it doesn't mean you have to do it that way, but it pretty much ensures that this will become a big part of your practice, or as much as you want. So again, it comes back to investing in the practice. Consider that. If you want to talk more about that, again, one of our consultants will be happy to talk to you. Just type in free consult, and they'll be happy to do it. Now, there's 2 types of patients, and Rich, you had some slides that kind of did this a little differently, but I think we want to talk about, there's people who know they have apnea, and there's people who don't know they have apnea. And both of them are in your dental practice currently. You go back in your practice tomorrow morning, and you're going to have patients who fit both of those. So we're going to talk about them a little differently, because when we're talking about consultations, we talk a little differently to patients who we think might have apnea, and we need to help them discover that they do or don't, versus those who already know they have apnea. So there's a big kind of difference between the two. Where do the patients come from? We had a whole lecture on this at one time too. So we're going to talk a little bit about how you obtain patients briefly, but go to our YouTube page again, and we have a whole much more detail on how they come from.
Guy, we could talk about any one of these subjects for, hours, but we got to remember there's a whole lot of people out there that have sleep apnea. We figured out in San Antonio alone, there's about 450,000.
Right. Just
in the city where I am.
1 in 5 of these people right here, if they're all adults, has apnea, which looks like most of them are. So you figure it out. So 1/5 of those people have apnea. They're everywhere. The key is, I think, what we've been hammering about these verbal skills are, you have to believe in yourself, you believe in your team, and believe that this is important. And once you believe that, your patients will forgive you if you misspeak, if they think you're sincere and you believe in this and that you have their best interest at heart. I can't give you enough verbal skills to say, oh, say this, say that. It starts with this. And once you have that, the rest of it actually is, you can, just tune us out the rest of the time, maybe, because this is really what's important. We're going to give you the tools to go with it. Of course, I'm kidding, but that is really the most important part, I think, Rich, as far as what makes the patients agree to treatment and then understand what's best for them.
Well, I know we're getting behind already, but I want to tell a quick story, guy, about when I first got out of dental school. And I've been a dentist for a week. And I go, man, you need a crown on that tooth. I couldn't say it one time. I had to say it about 30 times. And I remember, I don't know, maybe I just saw dollar signs or what, I don't know. But the guy really needed a crown, And I remember him saying, you know what, young man, I think you need that crown more than I do.
Oh, God.
But what a wonderful thing to happen the first week out of dental school rather than 10 years later. At least you figured that out. But that's the part that you were talking about where you care. And you just got to draw that fine line. You got to believe in what you're doing. Your staff's got to be there. You need to make that picture on the left bigger there, guy. That be prepared. I don't know where you got that, but man, that guy is certainly prepared. But be calm. Be prepared. Do your homework. Don't cut corners. All these things that we're talking about, because we're getting ready to sit down and talk to a patient. There's a couple things you have to have before you do that. Hopefully, you put your time in and you're empathetic, and But there are a lot of people out there. Yeah, there is a needle in a haystack. That's not what we're looking for here, guy. There's a lot of low-hanging fruit out there. We don't have to, where are patients coming from? They're walking through your doors every single day. That's where they're coming from. If you just strike up a conversation, hey, Dr. Drake's screening his patients for sleep apnea now. Oh man, I had that test. Really? What happened? Oh, they gave me that machine. Who can wear that? Well, you've already got a patient. He's already diagnosed, so but you got to screen your patients first, and that's that low-hanging fruit. These are the people that are walking through your practice every single day. So you got to have a system for how you're doing that. We figured out a pretty cool way to do it. We put it, and if you're not screening, those of you who are financially motivated, like most of us are, and at least when it's time for payroll, we certainly need to be thinking on this. And I think, did you leave your return on investment slide in here tonight, Guy?
Yeah, it's coming up in a little while, towards the end. But yeah, I certainly don't think everything should revolve around money, but we are a business. And sometimes dentists, when I say don't be a dentist, it could come to that, because somehow dentists are ashamed to make money, I've learned. And every other business wants to make money. They get up every day and proud they make money. And that should be a part of why we do what we do, because we owe it to our team. We owe it to them so that they can afford to come to work and want to come to work. It all works out better if we're profitable. That being said, we want to do it for the right reasons as well, which is helping our patients. So it all comes together, and it starts with screening. We talk about undiagnosed and diagnosed patients. You'll find both if you just start talking to your patients. If you just start talking to them about the susceptibility to airway problems, which we'll talk about a little bit, and then some of them will say, yes, I have apnea, I can't wear a CPAP. So really the goals of screening are on the screen here. the double screening word there, but you know, the bottom line is we want to look at all of our patients, have a system in place that we can identify those patients who have apnea and aren't successfully treated, i.e. maybe not wearing their CPAP, and those patients who are at risk for apnea, and get them tested. That's the goal of screening. You need to have a quick way to do it. And what we found is we talk to thousands of dentists each year about this. Everybody wants to go grab the dental device and go, oh, look, you've got a big neck, so I think you have apnea and you probably snore, and here's your dental device that's going to solve all that. And, you know, we jump down to the treat. And if you just break it down into steps, and we have a whole webinar on our YouTube videos about just screening and testing, we can go much better if we break it down. And there's actually really 4 steps. So we're not going to spend all night talking about it, but you need a quick way to say that person's at risk for sleep apnea for whatever reasons. And yeah, the patient will say, I get it. I see why I'm at risk. After you have a nice consultation with them, they need to have a method to be tested. They say, yes, I'll agree to the testing. Then if they have apnea, then we need to figure out a way to get them to afford treatment, and then we can treat them. And the way we do it, Rich, is something that we came up with, Rich and I did, and the team at DS3, to make this a little more interactive with the patient. We have a screening system that uses cloud-based technology, and we recommend getting tablets, and the patient just answers some questions. And then if they're at risk, it's going to come up with an arrow like this with the, hey, you're at risk. And that's, to me, what the thing I like the most about our system, Rich, is the arrow. What do your patients say when they see this?
Severe risk. Severe risk for what?
Right.
What do I do about it?
Well, then you just hit this little view results, you or your ambassador, and you talk about it, right? You have all the answers to the questions. It comes back to being educated, and there's a discussion. The patient says, well, I'm at risk. Well, you're at risk for having airway problems. And what that means is because you're sleepy, because you have high blood pressure, you have these things, these red flags of treatment. And again, I know we're at a high level on this, but again, screening.
That's exactly what the patients need.
Right.
You didn't use any big words there. You didn't say you're at risk of apnea. You said you're at risk for an airway problem.
Right.
You know, that's the verbiage that Guy has picked up on over and over the years that you do. So I like the acknowledge part about that, Guy, because you have to get a guy to acknowledge that he may have a problem. That was one of the questions, you know, earlier was, how do you get people to do this? You know, I will tell people, look, I challenge you. I want you to go home tonight and I want you to read about sleep apnea online for 1 hour. And if you don't want to do something about it, then there is a psychotherapist just down the street from you here that I want you to go see. I mean, I really say that. It's like, I mean, like you said, any normal person would want to have a healthy mouth. Any normal person, after they read about this, would want to do it. So, you know, look at the screener, express your concern, relate the hypertension, you know. Hey, we know that's related. We get a lot of bruxism. We had a couple of bruxism things. We can talk about bruxism for 5 hours.
Rich, your mic. You must have moved your mic a little bit. There you go. Go ahead.
Better?
Yeah.
A little better. Okay.
Yep.
You know, we can talk about bruxism forever, but you know, I like what you said earlier too, Guy, about don't just jump down to the tree. You know, here's their dental device. You know, hey, look at this. Isn't it pretty? It's all pink and you know, and wonderful. Don't put the cart before the horse. You know, we got to get you tested. So we got to have a way to get tested. And I think that's coming up next, right, Guy?
Yeah, it's coming up tested. I'd like to say one more thing about this slide before we talk about testing is I think it goes back to the one, don't talk too much and being comfortable with the pause. And this is where, so we you know, again, you go through the screener, you express your concerns. The red flags are why they're at risk. That's like Rich said, hypertension, snoring, all the things that the screener identifies. And we discuss that with them and listen and interact. And we don't use the word apnea. We just say we're concerned about their airway. And, you know, there's a chance you're not breathing at night. And you do that and you just look at them, you know, and he who talks first loses. And you got to be comfortable with the ability to just relay some information, have a conversation, and then be quiet and wait for a response. And, you know, most of the responses, if you'll do that, most of the time they, when they hear that, oh, they may not be breathing at night, oh, they may be at risk for these things, and you just shut up, they'll go, well, how do I know? How do I know if this is happening? Well, we got to test you. You know, we just got to measure your breathing at night. It's that simple. And there's 2 ways of doing it. You can go to the sleep lab, and they can wire you up like the guy on the right here, or you can do it at home. Which way would you like to do it? That's
I love that.
You know?
I love that.
Would you please?
Yeah. Do you want to do this or not? No. Do you want the home sleep test or the in-lab sleep test?
Absolutely.
That's like when you have anybody that has kids knows that. You don't say, you know, do you want to eat your vegetables or not? You say, do you want to eat the broccoli or the carrots or both? You know. So I like the way you said that.
And then if you're with a DS3, we have a really quick and easy way to do the home sleep test. If you can click a button, which most of you can, the simplicity here is it not only gets the patient to work with one of our home sleep testing partners, the data comes right back in to DS3, and it makes life a whole lot easier. So we have a whole nother webinar on just screening and testing if you want more detail. And again, if one of our consultants will be happy to give you more details, because I know it's a real high level about getting our patients screened. But if you do that, have the right verbal skills, you have a system to get them tested, things go very well. So at the end of the day, the goal here is to get them to be tested. We need to coordinate that sleep test, whether it's with a button through DS3 or one of our medical partners, or however we're getting the patient tested. Yeah,
because some states can't do that, guy, as a dentist. You know, so if you're living in one of those states, you got to have but you got to have a better way to do this. There's a better way to do it.
Yeah, and we can help you if that's again if any of that's not clear. We also want to make sure that we understand what the patient's symptoms are before we come into the consultation. And we're going to go through the questionnaire here in a moment. So we want to make sure we get that out to the patient so that they can get the questionnaire, so that we have that information for the next appointment. And by all means, make them an appointment. So we usually make it in 3 to 4 weeks. They're committed to coming back in now to discuss this. And we need to start looking into their insurance. Through DS3, you can do that with a click of the button. We can look at all their benefits with what we call an instant eligibility check. So now we're going to be prepared for the consultation. So fast forward 3 weeks later, 4 weeks later, the patient's had a sleep test, or maybe they already had a sleep test and they were already post-diagnosis. Either way, we're going to want to come back in and go over this information. And there's really 2 reasons why people will treat apnea, as we already talked about. One is for health reasons, and one is for symptoms. And that's what we want to talk about at the consultation. So wouldn't it behoove us to have that information before they walk through the door? So we're going to get a copy of the sleep test, and we're going to get the answers the answers to the questions about what it is about their symptoms that they want to address, snoring, sleepiness, and so forth. And hopefully at the end of the consultation, they're going to be, this is great, I want to do this. We need to be able to answer that question as to how much is this going to cost. So that's why we need that insurance information. So that detailed sleep questionnaire we do through DS3. The patient does it in a cloud portal. They just do it at home. It's all HIPAA compliant, and all this information is obtained before they come in. And we're gonna go through it fairly quickly, because it's not, we're not getting real granular here, but we want to know this information so that we can have a really quick have it quick at our fingertips when we talk to them. That's how we do this in less than 10 minutes of our time. Rich, what?
Yeah, we already talked about most of these guys. The chief complaint, if we just go right through these, they're going to check 1, 2, 3, 4. Sometimes people check 15 of those. That's right. When I say, well, okay, let's narrow it down to 3. That goes along with the realistic expectations, etc. We want to, when we make somebody a dental device and they come back in and for follow-up, we're titrating their dental device, and we want to know how they're doing. But we need a baseline to do that. How sleepy are you? How tired are you? If you rate your sleep quality, just on an average day, we got to understand that every day is different. I slept good last night before I didn't, that kind of thing. Bed partners are important. Sometimes that's part of the chief complaint. Do they notice the breathing, all that kind of stuff? So there's a lot of this without getting too granular, like Guy said.
Yeah, and important here is we've just taken what are some of the key things that is common to many people who have airway problems. Some, some are more important on some people. And we're just going to gather that information, their subjective signs, whether they've tried CPAP before or tried other treatments, how much are they wearing it, how little are they wearing it, what are their problems with CPAP. You see a lot of common things here about mask leaking and so forth. And so we have that information, as well as if they've tried dental devices in the past. And again, this is all being completed by the patient prior to when they walk in. They tried other things like weight loss or surgeries, and all this information. So the Epworth, the Thornton, this is a whole bunch of subjective information that we distill down into one page that we call our DS3 summary sheet. So that's how we do this in very, very quickly, because it's maybe 4 pages of questionnaire, and we look at all the positive information and it just puts it in one spot, so that literally in about 1 minute I can walk in that room and know, hey, this is what this patient is telling me before I ever met them about why they're here. Now we still have to talk to them, and we still have to dive deeper into these to what they put here, but we have a really big head start on our conversation with them about their symptoms. And so again, symptoms are part of what people a goal of treatment. The other goal of treatment is what we call objective, which is the health benefits, which we relate to the level of apnea that they have. Here's kind of just a quick checklist. You may have other things on here, but here's some things that you might want to have out in the room. So this is not some big armamentarium like you're doing a root canal. Good news is you don't need a whole lot. Is there anything on here, Rich, that the sleep test you have to have, and be able to look at the range of motion. Anything? You really don't.
I would maybe put an S on the end of device model. You need to have probably more than one. Like
right.
Guy said, our YouTube channel, choosing the right device. Pick 2 or 3, and get models. Have them made for yourself, or your staff members or something like that. And then you're just kind of looking. I kind of do a little mini exam at the consultation, Guy. A lot of people don't do that, but they're going to want to know, how bad is my sleep apnea? Right. When they sit down, because you're going to review that. This might be a patient a month ago that you screened, and then you help facilitate that sleep test, and they got the sleep test, and then they come back. Sometimes when we screen people, like I said earlier, Guy, oh, is this about sleep apnea? I don't need to take this. I already know I have it. I had a sleep test last year, and they gave me that stupid machine, and I won't wear it, whatever. That's what we're just trying to find, is that low-hanging fruit. But, without being too complicated, this is how many times you quit breathing per hour. Right. Your oxygen is going lower and lower. Anything below 90, if you're in the hospital, the alarms go off. Well, yours was 81. Does that seem low?
Yeah.
Well, you got to pause, and you got to do some of this kind of stuff, because you want to engage that person, as they're doing this. So without getting too, using big words, you just want to make sure that the patient's not breathing, their oxygen's going down, and they know that. And that's right. Related to their health risks as well as their chief complaints. And then you just move right on. Now we're getting to the point, Guy, where we can talk about treating it.
Yeah, and I think the key here is when we first started doing this, Rich, we'd get a sleep test, and it'd be 1 to 15 pages long, usually 2 or 3, and we've got all this information, and we're like, what do I do with this information? And so what we have here on the screen, it goes back to, how do we be successful at a consultation? You're prepared. You do your homework, you get a copy of the sleep test, and you pull this information out, all the things we have on here. And if you don't know what AHI and some of these things are, then again, we have full, that's what we do, is help teach this, and go to our YouTube page or talk to one of our consultants. But the bottom line is, we know what level of apnea they have just by looking at this at a quick glance. And now we can go in and talk to our patient and say, hey, look, here's your symptoms, here's your level of apnea, what are you trying to accomplish here? And they'll talk to us about it, and we look at their symptoms, and maybe they want to quit snoring or decrease snoring, and maybe they want to go from severe apnea to mild. They're okay with that. At least we agree on that. And so by taking those 2 bits of information, we can cut the time for the consult down a tremendous amount. At the same time, the effectiveness of the consult is far better, because the patient is engaged, and they go, wow, no one's really put it in this simple of terms, where we're just trying to look at your symptoms and making you more healthy. And then part of the consultation appointment is we might want to talk about which device they might be most happy with. And we've mentioned this multiple times. We have a whole webinar on that, but we can certainly want to discuss that. And the patient wants to hold it in their hand and agree that, yeah, I like this device. And we don't just say, here's 4, pick one. We want to be involved in that. And we want to help them choose the right, direct them towards the right device for them. But they need to agree to it, because that way the success rates go way up when the patient is involved in the device selection. And then, Rich, you know, we're big on medical documentation, and one of the things we spent, I would say, one of the majority of our time in DS3 was making sure that our software is compliant with EMR, and we have all the templates here for each appointment that you needed to fill out. And you darn well better make sure that you make a good progress note with all the information that you need, because dental sleep medicine falls more under the guidelines of medical, and we're not, as dentists, as used to making SOAP notes.
And that's all it is, basically, our SOAP notes. You get much better at it. You got to go back to what oral surgery class in dental school. That's where we first learned how to do a SOAP note, I think, Guy, right?
Yeah. Yep.
But you got to do the patient's going to ask, how much does it cost and what does my insurance cover? And if you don't have an answer,
right,
even if your answer is, I don't know, that's better than that. But if you back that up with, we called your insurance company 4 times, we tried to get a gap exception, they won't tell us what they allow. Again, we could talk about this for an hour, and we just did recently. Yeah. So that's on the YouTube channel as well, you know, if you want to see it. But, you know, we picked out things where you can just click a button in DS3, and oh my gosh, here's their in-network deductible, here's their out-of-network deductible, this is how much they've met, this is what percent they'll pay after the maximum allowable is met. Now, they won't tell you what the maximum allowable is, but this is what we do at Dental Sleep Solutions. You know, DS3, we try to help patients, dentists do this and implement this in their practice. So,
yeah, and that information will, you know, if you let us help you with this, talk to one of our consultants, or review the, I think it's called out-of-network billing on our YouTube page. We go into detail. From that information, you can tell them, the patient, well, here's what we call the MOP, the maximum out of pocket for your particular case, and we go through the verbal skills of how you discuss that with them and those. And so the bottom line is, we've gotten the objective information, subjective information. We've come to an agreement with the patient about what do we want out of treatment. We're going to help these symptoms. We're going to look to lower your apnea to this level. That's our goals. They understand we're a team here and we're doing this, and they agree to it, and then we discuss how much it's going to cost, and we're off and running. Now you have a dental patient, so a dental sleep patient, that is. We want to make sure, but you know, not to forget certain things. You want to make for an appointment the next time to begin treatment, because usually we can't begin that exact day due to the 3rd or 4th one down here, because some patients need pre-authorization. So oftentimes we have to wait a few days to get it pre-authorized. So we want to secure the financial arrangements, make the progress notes, and we have a page called the tracker page where it helps generate these really cool letters that go out to all the physicians. So we want to make sure the letters go out. And then there's again, back to insurance. If you're doing medical billing, you need a letter of medical necessity and prescription. And we could talk in detail about that as well, but I'll just leave it up there on the screen, because if you have all those things in order and you do a consultation, you can get this accomplished in less than 30 minutes. The patients are going to love you. They're going to know that you care about them. And furthermore, they're going to continue to appreciate what you do, because once you help them, they're going to tell all their friends. And you keep listening to these webinars, and we can tell you, you'll be a dental sleep expert in no time.
Well, you get more dental patients too, Guy. You know,
Yep.
A dental patient turns into a sleep patient, and that turns into more dental patients, which turns into more sleep patients, and it's a nice little problem to have.
Absolutely.
So here's the do's and don'ts again. You know,
Right.
hopefully we've shed some light on this. Hopefully we've given you a little bit of verbiage about not using, you know, apnea, hypopnea, AHI, RDI, things like that. So just talk about the airway closing down. We've given you a lot of that. Learn to be a little bit comfortable at times with silence. Be confident about and believe in what you're doing and the cost involved in that. So.
Yeah, and again, these are on the screen. We've gone through each of them, And so I don't think we have to go through them again, but I just wanted to make sure we put them back up in case anybody was taking notes. This will be back on the YouTube channel too, so you can review it again in the future. So each of these we could spend an hour on in particular, but I think the do's and don'ts really come down to the one slide we talked about, believing in what you're doing and being prepared. And I guess maybe we should put that together with being empathetic and really caring about your patient. If you care about your patient, and we really want to come to an agreement about what we want to accomplish, because it's not what I want to accomplish. You know, sometimes patients, I love that story. I think I've heard that one other time, and I've forgotten about the patient say, "You need this crown more than I do." That's a great story because it's not about us. You know, maybe we care about not having a heart attack, but all that patient there cares about is getting his spouse to quit elbowing him every night to roll over. And so we have to come to an understanding about what's important to the patients, not put our own values on them. We certainly can help them understand what their decisions, but if we're empathetic, prepared, believe in what we're doing, and we just have a conversation, and at the end of the day, we define what we're trying to accomplish and work out any financial responsibilities. You'll see that, I know in my practice, Rich, about 3 out of 4, about 72% is what it seems to go, between 70 and 75. The people we see for consult end up being treated, and that includes patients who weren't good candidates for treatment. How about you? Are you in the same ballpark, you think, Mark?
I think mine's a little better than yours.
Of course, you have to be.
As long as you say first, I could say, yeah.
Geez, I should let you go first with that one. Darn it.
Exactly.
Right.
No, but you're hitting the nail on the head there, Guy. The more you know, the more prepared you are, the more empathetic you are, the more you believe in what you're doing, the more patients are going to say yes. I think you hit the nail right on the head there.
And this doesn't have to take a ton of your time. These are the steps that are involved in dental sleep medicine. We've gone through lots of them in our past webinars. We'll continue to go through them. If you need more clarification, just type in consult, and one of our consultation experts or member support experts will talk with you. But these are the steps. And I know in my practice and Rich's practice is closer to 30 minutes of our time, because we have great sleep ambassadors in our practices, because we do a lot of this, that does a lot of this and does it well to the patients being very happy. And Rich mentioned this earlier, and I do a lot of lectures, Rich does as well, and I talk to thousands of dentists each year, and Rich as well, and I always say there's nothing that you can do if you're looking to grow your practice. There's nothing, not a single procedure, whether it's implants, Invisalign, that has a more open-ended financial end for gain. I don't think I said that exactly right, but that there's not a procedure that can bring more profit to your practice than dental sleep. The sky is the limit, and I have not had anybody really say that you know, the implants, this other thing. Not that those can't be profitable. Dental sleep can be extremely profitable. If you only did a device once a month, 12 a year, it can add pushing $20,000 a year, after you pay for your impression material, after you pay for a third-party biller, and after you pay for DS3 services. And if you do one a week, it's pushing 6 figures. And you'd have to not be trying to do one a week if you really want to do this. So the financial end of this is incredible.
Got to have a plan, though, don't you, Guy?
I love this slide.
It doesn't just happen, man. You got to cook up success, and we hope that you will consider, you know, we do these 1, 2, 3 a month, every month. We have online study clubs that we do for our members. Man, we're just constantly involved in educating our members and dentists about how to do this. And you don't have to reinvent the wheel. You know, we can help you do a lot of this stuff. And for the cost of 1 or 2 dental devices in an entire year, you pay for what we do to help you. So I hope you'll think about that.
Yeah, and if you want to know more about what we do, and even if you have a specific question, maybe you have a challenge with insurance, maybe you have a challenge with a dental device, maybe you want more clarification on the consultation appointment, just type in free consult, and again, one of our we call them our member support experts. They're dental sleep experts. That's all they do. They've been in the room's got 30 years of experience of doing dental sleep. They'll get on a meeting with you, address your concerns. If you want to know more about what we do and how we can make this process just go from being kind of not knowing where to go to streamline, they'll tell you all about that as well. So just type in consultation. I promise you, I've not had anybody call us up or email us back saying, wow, that was a waste of my time. You'll be very happy what you learn. Next week, in a couple of weeks, we'll be talking about medical referrals. This is something Rich and I know a ton about. Rich spends a lot of his time meeting with physicians, and this is something that could take a bunch of time, but we have come up with ways to make this even more efficient. I think that's our goal in general, is trying to take this process, all these moving parts, and make it more efficient. So Rich,
yeah, we've got a couple of skills too, Guy, for when you walk into an office, how do you get past the gate, the Gestapo there that's at the front of every single medical office. So we got a couple of tricks that we think will help you, and we hope you'll tune in a couple of weeks, and we certainly hope you've enjoyed tonight and learned something from it. We appreciate you spending your time with us. We hope you'll check out our online magazine, the Dental Sleep Insider. You can subscribe now by going there and just click on subscribe. Wonderful articles in there. It's a very cool digital platform where we can do videos and all kinds of cool stuff in that. So we hope they'll check that out as well.
And again, this is what we do at DS3. The 4 pillars is if you want to be successful in dental sleep, if you have a system for screening, testing, treating, and billing, you're going to be successful. You're going to have more patients than as many as you want. And how to do that, you have to be educated. You might need some hand holding, some coaching. You certainly need a EMR software to help make this more efficient, and you're going to have questions along the way, and you'll need support. That's what we provide. The things in green are what we provide our members to help them with the 4 pillars: screening, testing, treating, and billing. And I can tell you that that I wish I would have had that when I started, because we spent hours and hours and thousands of hours trying to figure this out, and we continue to make our systems better. And it can make, if you want to do this and it's maybe been overwhelming in the past when you've gone to courses, we can take you through what we call our DS3 experience, DS3X, and it's just 4 modules that we walk you through, you and your team, and within 3 months you will be delivering devices, making a profit, and adding this valuable service to your services that you have in your dental office. So this is how you get a hold of us. I want to mention, for people that came on a little bit late, we also do courses throughout the year. And if you're interested in doing a live course, we're all over the country. Just type in course and you'll get a discount. Once someone will contact you, one of our team members will contact you. We'll give you $100 off a 1-day course or $200 off a 2-day, and they're already very reasonably priced. And I'm going to Mechanicsburg, Pennsylvania. I think we have a couple dozen dentists and as many staff there and team members this weekend. I love doing the courses. I know that one of the positive things is at the end of the day, everyone thanks us, and they get a lot out of it in addition to fulfilling their CE requirements. And we're going to continue to answer your questions. I see them still coming in here, and, but I wanted to personally thank everybody for taking the time out of your evening to learn with us, and I hope this has been beneficial. Rich will stay on here. You want to say anything while we're answering these questions? I'll look at the questions.
Oh, you're going to let me talk now, huh, Guy? Thank you.
Yeah, well, I got on a roll. Sorry about that. Just to get us finished on time.
Yeah. I think we got pretty much most of them. I was trying to look through them as we were doing them, answer a few, and I think we're good. Yeah, and if you guys haven't had a chance to attend a course in sleep medicine, we really recommend that you take your team. We try to make it reasonable enough that you can do that. Again, questions are asked more of your team members than you, and this is all part of this process of the learning curve. And if you get a chance to hear Guy speak, he's a wonderful motivator and educator on that kind of stuff. And you don't have to reinvent the wheel. That's the big thing here, So I think I don't see anything in there more, Guy. There was one thing about, how do you convince somebody they really need to do something about that? Well, when you've figure that one out, you let us know. I mean, you know, you educate people, and any reasonable person, if he thinks he has severe sleep apnea, would want to treat it. If the first guy you tried to treat was the guy that doesn't care if he dies or not, that's not everybody. You know, don't give up. Don't tuck your head between your legs and turn around and run the other way, because most reasonable people want to be healthy and they want to do something about this.
Yeah, and so if we're talking about, you know, someone who won't get a sleep test, you know, that's a great question, and I'm glad that we're answering that verbally instead of trying to type out that answer. I will say this, that it really truly comes down to that belief slide, that you have to believe in this. And the reason I know that is Rich and I have gone in dental offices who say, my patients won't agree to sleep tests. And
an hour later, we have 3 of them lined up.
And they've never met us before. And you know, and you've known the patient for 15 years. They've been coming to get their teeth cleaned. And what's the difference? The difference is Rich and I've known patients who refused sleep tests who died, or who accepted treatment, and I mean, who got a sleep test but didn't accept treatment. Said, I'm not going to treat it, and died in their sleep. We believe this is extremely important. And when you believe in it to that point, the patients will say yes. But I'll give you, so that's kind of makes it sound like a cop-out, but unfortunately, it's the truth. But if you believe in this enough, then I would suggest that you tell the patient, you know what, Mr. Jones, you've been coming here for 15 years. I know you and your family. I'd be remiss if you don't do this. So look, I'm going to pay for your test. I'm going to get you a test. If it's money, let me pay for it, because I really think you have to have this done. See how many of them take you up on that. Okay, I'll bet none if you really believe in it, because I've done that, and most people don't take you up on it. So again, it comes down to the belief. So great question, and I think that it's something that as you become educated and more competent and believe in it, you'll take care of it. Anything else on here, Rich?
Here's one more guy about, you know, we at my office, I don't charge anything for a consultation. We just, you know, it's no obligation, no fee. Could we? Yes. If you're going to do that, you need to make sure that you document medically and for billing purposes appropriately which code you use. We just bypass all of that. We kind of throw in the consultation fee, which I think, you know, Guy, $50 to $100 is reasonable. We just kind of put that in the cost of our dental device. Right. And so we get it back. Do we do occasionally? Do we do consults where people don't move forward? Yes. We do, but we don't charge for that. You know, what do you think about this OSA statistics to scare people, Guy? There was a question about that.
Let me add one thing about the consult. If you're talking about the free consultation for one of our team members to speak with you, that's no cost.
Okay,
I want to make sure. I think that you answered the question, but I wasn't sure. I want to make sure if they were talking about the free consultation, no cost. I agree with Rich on the consult as well. So. You know, it's up to you.
Either one is free.
Yeah, either one is free. But I would say this: if I could tell you, I'll give you 4 consults for a 3-unit bridge, and every 3 out of 4 will say yes. Would you do them for free? You know, I think most of you would.
Let me think about that for a second.
Yeah,
that's a no-brainer, Guy.
It's a no-brainer. So that's and if you want to work with medical physicians, that works out better. It's your choice. So the other one is, you know, what statistics? You know what? I'm not trying to scare anybody. I think I don't. I want to share with them. It's up to them what they do with this information. And I think I will say that, you know, if you want to watch our YouTube video on screening, we get into that in more detail. But I mean, you need to go back to what we call the red flags and understand, well, look, you're at risk for this, you're at risk for that. And we have the statistics for that on there. You know, diabetics, 48% the people.
50%, yeah.
50%. So those are the red flags that we didn't have time to get into. And you know, I think.
You know what I like for that one, Guy? I like that Wisconsin sleep cohort. You had that slide in here, and I might have taken that out. I apologize if I did.
That's my favorite.
Look that one up. It's 1,000 patients, and then they look at them for almost 20 years now, and normal, mild, moderate, and severe. And you know, about half of the severe patients are dead.
Right.
after 15 years, and only 3% of the normal patients are dead after 20 years. That's a pretty powerful study right there.
Yeah. So, and if you need a copy of that and don't understand, if you can't find what Rich is, the Wisconsin Sleep cohort, it's a great study. If you can't find it, just contact us. We'll help you direct you towards that. But I use that on all my consults too, Rich, if they want to know where we're going to move them from severe. And I don't think I do it to intentionally scare them, but I guess it does scare them. I want them to be informed. I mean, I do have that patient says, I don't care if I die. Maybe their life is more miserable than mine. You know, I'm not going to judge them. That's their choice. But my goal is that they need to understand they are risking shortening their life, and they're risking having heart attacks. They're risking not feeling as well on a daily basis. And, you know, most reasonable people at that point go, well, all I got to do is put this piece of acrylic in my mouth to avoid all that. Why not? How much is it? And we go through that. So, all right. Well, I think we've gotten finished pretty much on time. We've answered, I don't see any more questions in here. So I see.
I see a classmate of mine on here from 4,000 years ago. So yeah, I'm gonna have to, Rich D, if you're out there, call me tomorrow at my office.
Cool.
Same Rich Dorsey. I remember he wants to go to the course in Vegas. So.
All right. Well, very good. I'll see you there. Well, thank you, everybody. If you have other questions, again, you've got our information here on how to get in touch with us. We wake up every day that their office has power and not under a hurricane warning, and Monday through Friday, that is, and try to come to work with the attitude and we embrace is to help dentists help their patients live longer, live better, and you know, it's worthwhile. We feel good about it. It's I think about all the offices that we've helped and all the dentists that have helped their patients, and it's a worthwhile cause, and I think you'll be happy that you got involved with it if you're kind of new to dental sleep. So I hope to see you in a few weeks on our next webinar, and I think I'm ready to go see what my mom cooked for dinner because I haven't had it yet.
Sounds good. I'm
staying at her house because she has electricity and food, so it's a great place to be. Everybody have a good night. Thanks, Rich.
Thank you, guys. Thanks, Guy, for putting that together. You guys have a good evening.
All righty. Bye-bye.